see. We're live. Hey, everybody.
Yeah, we are live, Jason. So welcome everybody to our to today's edition of our Wednesday. We're kind of trying to figure out what to call these things now, but I mean, we started with live cast. I know that we're also calling them our master classes, and I think we can legitimately call them that now because because of today's guest. But before we get into that, some cool updates, and I want to start using these live casts as opportunities to also kind of publicly go over things that are changing with any or all of our products. So, I mean, one of the big things that we're working on that we're in beta testing with now, we're in the final phases here, is our e-commerce platform. So for those of you who have been waiting for that, we are waiting on, I think, one more piece of the puzzle, and then we're going to be reaching out to our beta testing practices to try it out, which is going to be very, very cool. So anybody that's looking to eliminate the overhead of keeping products in their office and not have to worry about, am I getting the best wholesale price for, this BioFreeze or this TENS unit or whatever it is.
That's a headache remover. That's nice.
Yeah, I mean, I think we're moving also, one of our clients, Prairie Care, we've been talking to about products that they're looking to offer, like aromatherapy and things that are kind of supplemental to the therapy care that they do. So that'll be pretty cool too. Jason, anything with the Vericle product, the cloud-based platform that we should
There's
highlight?
one topic. There's one topic on everyone's mind right now, and that's ICD-10. We'll be hosting a couple of live casts or webinars. I'm a little.
That's what I'm saying. Like we need
the terminology.
We've got to decide on a name. Let's just call them our master classes.
But I'm really excited to show everyone the tools that we've come up with that allow people to not only look up their ICD-10 codes, Reuben, but actually, for one of our larger multi-specialty practices, they had over 2,000 ICD-9 codes that they've used in the last 5 years. But they've only used 12, 88% of the time. So we've allowed these memory tools to allow you to look up your favorites. And I'm really excited about showing all of our clients and somebody who's maybe considering using us those types of tools to make ICD-10 transitions a lot simpler. And then please look forward to us getting some other rock stars on here to talk about some documentation, because ICD-10, choosing the codes is like 20% of the battle, guys. The rest of it is making sure you've got that documentation in place to support that code. So that's an
interesting point. I think I'm going to bring that up the next time I talk to Julie Thorne, who's a nurse practitioner up in Georgia at Superior Healthcare. Because, I mean, I swear we spent at least 2 hours talking about Medicare documentation requirements and how they're insane. I mean, they go into such detail.
Specificity, right?
Oh man, it's insane. But yeah, I mean, ICD-10, I know that we're gonna have Kathy talk about that as well. She was up at a boot camp with us just maybe a month ago now, where we talked about ICD-10. I think there's a video on our page about that, like a clip of her talking about it with another doctor. Jason, do you see John?
I do.
Popped in. Is he ready? Can we? John, are you there? Did we connect your line?
He's in there. I see that he's talking, but we're just not getting any audio right now.
All right. Well, while we figure that out, one thing that we always want to remember with our products that we're talking about is, if you're not already signed up to be a beta participant for the e-commerce, definitely now is the time to sign up. We're happy to add you to it. Obviously, we're trying to limit the total number of practices that we're beta testing with. But I think right now we've got between 6 and 8 practices that we're planning to test with. So, and I think we're trying to keep it to like 10 or 12 max. So there's definitely a few spaces left to open if you think your practice could benefit. Especially, I mean, I think the two big things with that are going to be if you want lower wholesale prices on your products. which is guaranteed because we buy at larger, much larger volumes than an individual practice would. And two, if you want to eliminate having to buy a stock beyond what you're actually selling, and only actually purchase wholesale what you're selling. I mean, Jason, I think the only thing that's interesting about that, and one thing that I found when I work with practices about products is, you may want to keep one or two in the office for samples or to show what it's going to look like, right?
There's always going to be a need to keep some on hand, right? You might even want to send some, home with a VIP person who's made more referrals than you could possibly count, right? And you want to just send them home with some. So yeah, you're going to want to keep some on hand. I've found most of our successful practices do that.
Yeah. Okay. And how are we doing with John's line? Are we making any progress here?
We're struggling actually a little bit there, Ruben.
Is Uber conference giving us trouble?
It is. It is giving us a fit, if you will, and so.
So one other thing that I wanted to highlight, obviously one of the groups that we're working with is on our iPad, iPhone, and Android application for consulting groups, whether it's coaching, legal, whatever it is, to communicate directly with practices in a HIPAA compliant way in a closed space that in future releases will actually tie your EMR, your practice management solution, to that app, so that, let's say that you're a legal expert like John, and you want to help a practice, and you're going to go review documentation. Well, if you're a trusted and connected legal expert to that one practice, you could actually get permission to jump into a patient account and check records for that practice for compliance without actually having to go through and jump through the hoops of getting someone on the phone and waiting for them to get the records for you, which could be very, very cool. So if you're not on our list of beta tests for that already, you definitely want to be. And what else? What do you think?
I'm excited to talk about a lot of things. It's just I know I was excited to hear from John, and for some reason we cannot get him in, Ruben.
Okay. Well, one of the things that I wanted to talk about today was with regards to Vericle and multidisciplinary, because as we know, like years ago, we started just chiropractic, and we started working with some physical therapies connected to those chiropractors. And now in the last few years, we've been really seeing a surge in integrated practices. And I think it's interesting how Vericle has kind of evolved to deal with that. I mean, how many rules? Thousands of new rules have been added since then, right?
We're over 2.5 million now. I don't know how many have been added, but I know a couple of years ago we only had 1 million, and so 2 years ago we only had 1 million. Now we're at just under 2.5 million rules in the system. It just keeps getting more and more complex based on if you're only seeing one specialty, it's uber complex. If you're seeing multiple specialties, it becomes nearly unmanageable, with just memory management.
Right. Absolutely. And, when you're working when we're working with practices, I mean, Jason, in your case, what are you finding is the biggest hang up with getting a multidisciplinary practice off the ground?
The first thing, and it may sound pretty rudimentary, pretty simple, is the coding and the modifiers. You've been doing one thing. You're a chiropractor, you're a PT, you're a doctor. You've been doing one thing, and you've been billing out a certain small spectrum of services for a long time. You figured, I can read the book, I can read a pamphlet, and I can get the experts in who are employees, and they'll know how to bill out the other services that I want to offer these patients who I'm able to treat them for their diagnosis, but there are more things that another couple of specialties can do. But learning how to bill and what you can get reimbursed for that, we're finding is a problem. We've got a couple of providers that just came on with us, one in Texas, one in Minnesota, Ruben, who right around April added additional specialties to their practices, got the new tax ID, got themselves credentialed as a medical office as opposed to, you know, a chiropractic office, which they were before. So now they're looking forward to not only treating the patients, but they've got more overhead, and they're looking forward to taking care of that overhead handily and then actually turning a profit, which will allow them to grow their practice, add locations. And what they're finding is that they need coding advice. They need people who can actually help them figure out which codes and which modifiers. We're able to provide them with suggestions, but because we're doing their billing for them, we actually cannot provide the coding services because it's a conflict. So if they're not able to understand exactly what codes and which modifier combinations, and wait for it, Ruben, this may sound again like it wouldn't be a problem, what fees they can actually charge, what's usual and customary, they find themselves going through a trial and error stage, which leads to some frustration. So get the experts involved right at the beginning. Make sure you know exactly which codes, which modifiers for the services that you plan on providing are going to be required, and then make sure you know what fee schedule to charge for that.
Wow.
I know you asked for a little, but people are not thinking about these things, Ruben.
Right.
And we see them mounting frustration because, you know, you just took on a nurse practitioner, a PT, and another chiro. That's a lot of salary. It's a lot of overhead, right?
It's an incredible amount.
And now you've got to support it. And if you don't have preparations in place to get billing out the door, not 3 weeks later, not 2 months later, but day one, those frustrations can start to grow and actually fester into something worse because, you know, now you're maxing out credit cards and things like that, and you don't want to do that. You don't have to do that.
Really?
That would be one of the biggest things, and we're not seeing it. If it was just once in a while, that's one thing, but we're seeing it more consistently than I'd like to. I'd like to report.
So, I mean, obviously there are a lot of challenges with bringing on an integrated practice and integrating the medical model into an office. But I mean, when you're trying to, I find when you're trying to integrate specialties other than chiropractic, and I think this is really only because of what the schooling is like. In the difference there. I mean, because in chiropractic, you're looking at, classes that focus on how to succeed as an entrepreneur, which kind of makes sense because if you're an MD or an NP, you generally start off, I would say, in some sort of hospital setting, right? I mean, you're not going into an office to train generally. You know, you have to match into a residency or match into a program. And so I feel like the emphasis then leads to kind of a lack of comfort when it comes to this process for like nurses and doctors and MDs and things like that, right?
Well, your administrative training in that type of setting is completely and totally different. First of all, the compliance risks are now shared, right? And there's typically a bureaucracy in front of you that says, hit this, this, and this, and you'll be covered and we'll be covered because there's shared risk there, right? You go out on your own, there's no shared risk. It's your risk, right? And it's your type 2 group NPI number that's on the line. And so that's a part of it. And then there's the money, right? The coding, the hospital situation or that type of group situation, typically there's billing experts, there's coding experts, they're not conflicted. And in that moment, they're able to provide direction. So that doctor, can I call it a crutch, Ruben? At that moment, they've got a crutch. They don't have to run on their own. But
yeah, I mean, I don't think there's a problem with, you know, a lot of people, and this is interesting, will say, a lot of people will say that, that the word crutch seems to
Yeah, that's why I was reluctant to
yeah,
say
it kind of feels like it has a negative connotation, but I think it's important to recognize where our limitations are. You know, if you're like a heck of a great MD or nurse or chiropractor or physical therapist, whatever, you're an amazing clinician. And the one place you struggle is administrative, you know, great. Let that be the thing that you reach out for help on. Let there be a crutch for you for that, you know?
Yeah.
You know, obviously the first step in solving any problem is realizing there is one, right? So
can I compare it to religion for just a second? You know, there are thousands and thousands of religions. Everyone says, hey, we're the one, right? And there are thousands and thousands of coaching and practice methodologies, and they all say they're the one, right? And although religion can be somewhat of a sensitive topic, I don't mean to get in religious discussion. How do you know which is the right one, right? You're listening today and you're thinking, are these guys the right one? Because there are other services out there. There's competition in the marketplace, right?
yeah.
Really, it's a referral-based business because you want to see, hey, has somebody I know and trust gone there? Have they succeeded? Have they used this service? Has it worked for them? Are they happy with the results? And that's where I always recommend that if somebody calls into us, yeah, talk to one of us. Talk to all of us if you want, but it's still not going to put your mind at ease. You have to speak to somebody who uses, you know, this service or, you know, any other service that you're looking to utilize to make sure that the expertise and the coaching services are there. And that's where I, you know, no matter what credentials I have after my name, it doesn't matter because they're not MD, they're not DC, they're not PT. And when I want somebody to take our word for it, I'd like them to talk to one of our clients that's using us right now, because that's the voice that matters, right?
Yeah, I mean, there's a minimum condition, you know. I mean, we could be fantastic at organizing a practice and making it run efficiently beyond anything an MD could do on their own, but I mean, who cares if nobody's getting treated? You know, we've got this, it's, you know, like putting an MBA into a non-existent business. Like, there's no product, so who cares how good you are at making an efficient process?
Yeah.
And that's true. I mean, there's always a minimum condition that needs to be met, and anything that you put on top of that, like a solution or coaching or consulting or anything like that, is a result of what needed to be there initially. It's, I mean, the analogy I always use, generally, because most of the clients I work with are motivated in some way with fitness and nutrition, is that, you know, unless you have the minimum condition of wanting to be healthy, I don't care what program you go for, whether it's CrossFit or LA Fitness or, you know, Beachbody or, you know, all that other stuff out there. There are thousands of options, you know, and so the last thing you want to do is try to just get an option and then hope that it'll work. I mean, first you have to actually want a solution to a problem. I mean, you have to recognize that you have an issue. Otherwise, you're just giving away money, right?
Yeah, we've seen that happen. But, you know, there's always this guard that clinicians I work with have up at first, right? Before they realize that we're in the same boat with them. Because, you know, let's face it, if they don't get paid, we don't get paid. 95% plus of our customers that we work with, we share profits. We share success fees. So if they're not getting paid by insurance companies, we're not collecting a fee either. So all of our advice and motivation, it's going to end up being directed at getting them paid. And at first, it might seem like I've never done basic training, but, you know, why are you making me do all of this stuff when I don't want to? I just want to focus on treating patients, and we want them to focus on that too. But the prep work that goes into making sure that they're ready to treat patients from an administrative standpoint. We had a practice just come on the other day, Ruben, that you know, isn't credentialed yet. And they said, well, just get us set up. We'll start billing out. You hold all of it. And although I want to get all of those dates of service billed out in our system, it's in our financial interest to do it. I don't know how long it's going to take them to get credentialed. They have another system set up. And so we had to tell them to keep billing out of their other system. And it's, they want to move over to us, and they don't understand our motivation is getting them paid, because we know their frustration is going to mount. It's going to get really bad if 3 months go by in the credentialing process and the linking of MPI numbers for the employees that you have, if you cannot get the money through the door. So we do give some advice that seems counterintuitive at the time, but it's because of our experience and how that actually does two things. Number one, helps them keep cash flow coming through the door. And number two, it helps them understand that we have their best interest at heart, because 3 months go down the road and they can't, get credentialed. They're going to go back to their other system anyway, the one that will allow them to fill out under that submitter number that's linked to their other credentialing experience. So there's really no way of preventing that. I want to see two things happen with a practice, right? I want to see them feel confident in the next step that they're taking. I want to remove as much doubt as we possibly can, but then we also want to see them be able to treat. Most of these guys didn't get in the business for the money. They actually want to see patients get better. And if they're not able to do that, I know that their frustration and their experience with us is going to be less than stellar. But back, Reuven, to those fee schedules, I'd really like to see our company be able to actually present a few things that would allow sharing of fee schedules, maybe even if it's just anonymous, so we can start coming up with what usual and customary looks like per region, per specialty. I think that would be pretty useful to our clients. So just an idea I had while we were sitting here. As far as the other thing, one other thing hit me as far as what practices will run into or experience in semi-negative way, and that's preparing the new clinicians to actually do administrative work. Oftentimes we see new practices come on board. They very much want to get their new clinicians up and running, but they can't, because their new clinician doesn't know how to document, doesn't know how to do the charge entry. They're not used to doing it in their hospital setting or their previous place. And now that they're working in a small business, they have to change. So preparing those clinicians to actually understand coding and what fee schedules are going to be used is another part of a successful entry into a multidisciplinary practice.
Yeah, I mean, you can't. I don't think you can avoid the need, to become. I mean, the only way to avoid it, really, as far as I can see it, is if you enter bureaucracy and join like a hospital network as an employee. But even then, I mean, if you want to get to any level of success, you're going to have to. I mean, I know my brother is a surgeon out in Michigan, and he's sat in as a resident on conversations about EMR. Yeah. Where they bring him in and they're like, "Hey, what's the deal? What do you think about this software for our hospital network?" And he's a resident. I mean, he's a chief resident, but still, I mean, that's just. I've been here a little longer than everybody else. You don't
know how to vet software. That's not your
like
job.
how. What I mean, unless somebody has a background for that, how can you honestly, make any headway there?
Focusing on building a team, retaining patients, treating patients, doing the administrative work, and then heaven forbid, Reuven, you actually have to be compliant at the same time, right? You don't collect a couple of copays for a Blue Cross Blue Shield and in network patient, and now all of a sudden you're at risk. These are things that they have to be focused on. They have to, be done. But we want to take that focus away from the doctor and allow his staff to competently do it while they're able to focus on building a practice. And more, everything I read says that even insurance companies are incentivizing people to build multi-specialty practices so patients can actually get treated for their ailment, get it done quicker. The insurance company in the short term might have to pay more money, but all of the evidence says that'll save everyone money, anguish, and grief in the long run. So we see this happening more and more and more. And there's that one practice owner who takes all of it on their shoulders now. It was challenging when it was a single specialty, and now it's a multi-specialty. They've got to be able to trust a team, and we want to be on that team. That's our goal. That's our offering.
Right.
Make us a part of your team.
Yeah, and I mean, with the multidisciplinary, I think it's just so true that that it's moving in that way. I mean, if you've got an issue that's going to require your primary, a physical therapist, and then maybe one of the most common specialties out there, whether it's orthopedic or something like that, where you can literally just walk from one room to the other, as opposed to scheduling a follow-up visit. I had a conversation with an ENT once. It took 6 weeks to get an appointment scheduled. In the meantime, what's going to happen to the underlying cause of your condition? I mean, it's only going to get worse.
Exacerbating each day, right?
Yeah, you just wake up thinking, wow, I have to wait another 6 weeks to talk to someone. And people used to talk about, single payer as being the situation where we would see that, but it's already the case where you see things like that, wait times and all that.
Yeah, it's happening. I mean, we're relatively healthy, right?
Yeah.
There's a large part of our population that needs legitimate healthcare and coaching, and they're waiting months and months to get it. Again, that's the doom and gloom part of this. That's not every situation, but it's a decent enough part of America where it's worth talking about.
I think so. So one other thing that I wanted to touch on, with regards to the multidisciplinary is documentation, because one of the pieces of one of our products is called XMR, extensible documentation. With regards to actually saving time, because obviously at the end of the day with any system, one of the big misconceptions is I need this shiny system that I'm going to enjoy working in for hours and hours and hours every day, when in reality the last thing you want to do is have a system that takes you hours and hours a day to do anything in, but happens to have big buttons that requires 20 clicks. The whole goal really should be to spend as little time as humanly possible within technology and as much time with the patient, right?
Well, you're talking an age-old adage of, I might have to put more time in upfront, but I'll save it over the long run on all the little transactions that add up. And it takes vision. It takes patience, right? 1971, Stanford, they did the experiment with the 10 5-year-old kids, and only 33 of them, 30% of them, they go in and say, hey, listen, you can have 1 marshmallow now, or if you wait 5 minutes, you can have 2 marshmallows. If you wait 20 minutes, you can have 5 marshmallows. 3 kids.
I hate marshmallows.
Well, these kids love the marshmallows, okay? And 3 kids were able to say, I'll wait. The rest of them are like, done, marshmallow, I'm out.
Yeah, I gave it a shot.
And I would encourage anybody who's listening to this, be a part of that elite group that was able to wait, all right? Maybe you don't want marshmallows, but if you're able to wait, if you're able to put in the upfront time, learn a system that has the potential of saving you 25 seconds, 2 minutes, 5 minutes, 10 minutes for each visit in some of the worst case scenarios that we've seen over the hundreds of patients that you're going to see a week. That is what liberates you. That's what sets you free to grow your practice, to spend time with your family, to go rock climb, whatever it is that you want to do. That's the Liberator. The upfront and initial effort that it takes to learn something at an expert level, that's what I would recommend doing every time. Our system or any other system, you're never going to get all that it has to offer unless you go in, guns blazing.
Yeah, there's really no other way to look at it.
I honestly, face, but I knew he was cringing when I said marshmallow.
Yeah, well, no, but you know what? It actually brings up an interesting point, because when I look at it, let's say that it is marshmallows. 20 minutes are going to go by. I'm not going to eat it, and I'm going to end up with 5 marshmallows. But at that point, let's say long term, marshmallows aren't for me. I can give out marshmallows now and get something else in return for that 1 marshmallow from 5 different people.
When you were 5, you were going to eat the marshmallows. Stop it.
Well, it was sugar. What do you? I stopped. Try to tell me not to eat sugar. Even at this point, I would eat it anyway.
Yeah.
But yeah, definitely. I think that plays into a big role, for those people who are consultants, who are coaches, who are working with practice owners, whether you're trying to get them to get more out of a product, or you're trying to get get them to get more out of a process, your way of thinking, your solution to their problem. I mean, one of the biggest things, biggest misconceptions is always that, you know, we're going to demand more and more of their time, and as a result, they're going to lose time with their patient. And I think that's one of the first upfront contracts or first commitments that we can make to a client, to a practice owner, to a staff member. Is our goal is to have you spend less time in the system, more time with the patient, and you know, that's it. Stop there. Does that make sense? Yes. Okay. Well, that's going to require some upfront investment. You know, can you do that for me? Because it's really going to pay off. You know, do the push-ups now, you know, lay off the donut, and eventually you can ease that stuff back into your diet without worrying about, you know, stroke and heart attack and diabetes and all those other awful things.
Oh, those don't happen in real life. Stop it.
No, I've looked it up. It doesn't happen.
Okay. All right.
You know what? Let's take a poll. Does it happen? I don't think so. But anyway, so too bad about John today, but you know what? I've been talking to him throughout this entire thing. None of you got to hear it, so I got all the inside scoop nobody else could have. But what we'll do is we'll take it into two levels. So obviously I want our coaches to benefit from John's knowledge base. John obviously is a hugely knowledgeable person when it comes to obviously New Jersey healthcare laws and fraud and all that, but in general when it comes to you know, the legal side of all this. So I definitely want to get him an opportunity to join us in a conversation. I'm going to talk to him and get that put together for us. In the meantime, Jason, we've got some guests lined up over the next few weeks here. I mean, next week we're going to talk about operational versus performance metrics on monthly check-ins. On our side, we call them monthly health checks.
Put a lot of cool stuff together for that,
which is, I think, going to be really cool. The following week, it looks like we're going to be joined by Michelle, who is a super, super successful coach. And then we're going to talk to Erez, who's our CTO, about tablets, which is going to be hugely useful for anybody that wants their client to save time on documentation and have more patient face time. And then actually, on September 9th, Yuval's going to talk about some interesting, well, he's just going to join us for a conversation. I think we're going to talk a little bit about what's led to a lot of the changes, because he's been around a little while. And then we're going to really start. I mean, Kathy's going to join us, and we're going to talk about ICD-10. So we've got a lot of really interesting stuff coming up, and I'm probably going to throw somebody out and put John in, because I want to have that conversation as soon as humanly possible. And I know that he's got a lot of interesting stuff going on that that a lot of people would be interested in, programs and things like that. Am I missing anything? What am I missing? I know I'm missing something.
No, it doesn't sound like it.
Buy one of our books if you haven't already. If you haven't already, definitely check out Practicing Profitability, Medical Billing and Processes, and Treat or Be Treated, which is the newest one. All of those are on Amazon, Barnes and Noble, and a bunch of retailers now that I have never heard of. I don't know if you've seen these, Jason. When you go into Amazon, I guess they buy them and then sell them like slightly used.
I have not.
I don't know what the deal is with that, but I think that there's a bunch of them, bunch of book retailers there for that as well. How about events? Where are we going to be? I know that we're going to be at the Florida Chiropractic Association at the end of August with Physician Business Solutions. Anywhere else, Jason? Where are we going to be?
We're going to be Maximize Living end of the month as well. They've got a big one. Their national conference out there in Dallas.
Awesome. And we're actually going to have one of our clients out there, Billing Precision Genesis, is going to be there with Rusty. That'll be cool. And I think that's it for now, right? I mean, we're visiting clients all the time, but those aren't big events.
They are to the clients.
But they are for the clients. You're right. I shouldn't minimize those.
Yeah.
All right. So next week, be prepared for our next live cast, and and we'll go from there. Thank you guys so much.
Oh wait, I'm sorry. I did find out we're going to be at ChiroFest. We're going to be at Amped. We're going to be at ChiroFest is in September 18th and 19th. It's gosh, thousands of chiropractors and then thousands of their staff are going to be there as well. So and Amped is actually coming up in 2 days. 2 days. Amped is in Georgia.
So. Get your tickets, book your flights. Those aren't going to be too expensive.
Yeah, good luck with that, everybody, if you're not already booked. So.
Maybe just tune in. Yeah, I mean, I know that at some point, one interesting thing about these events, I know that from POI standpoint, we're going to be doing some of these events live on location in the future. So so that'll be fun too. But all right, cool. So next week we'll get together. And thank you guys so much.
All right.
Take care.
Thanks, guys. Bye.